A 58-year-old multipurpose woman attends the outpatient clinic with asymptomatic vaginal bulge. On examination, pelvic organ prolapse quantification was used to assess the stage of prolapse. All measurements were recorded on the attached grid. What is the stage of pelvic organ prolapse? Pelvic organ prolapse quantification, known as POPQ, quantifies the stage of prolapse. It measures 9 distances. All distances are measured during Valsalva, except one distance known as total vaginal length, or TVL. The reference point for all measurements is the hymenal margin. The measured distances can be recorded on a 3x3 grid. These 3 distances assess the stage of apical prolapse. 2 points on the anterior vaginal wall assess the stage of anterior compartment prolapse. Another 2 points on the posterior vaginal wall assess the stage of posterior compartment prolapse. And 2 external measurements assess the shape of the perineum. Let us start with the apical compartment. Ask the patient to relax, reduce the prolapse, and measure the distance from the hymenal edge till the posterior fornix. This is called total vaginal length. Then ask the patient to strain. Some prolapse may happen. Now measure the distance from the hymenal edge till the tip of the cervix. This is called C. And measure the distance from the hymenal edge till the posterior fornix after straining, and this is called distance D. Now we know the total vaginal length, and we can assess total vaginal length minus 2, known as TVL minus 2. With straining, the apical compartment can descend, and descend more. Any descent in the area between TVL minus 2 and 1 cm above the hymen is considered stage 1. The apical compartment can descend more and more. Any descent in the area between 1 cm above the hymen and 1 cm below the hymen is considered stage 2. Further descent in the area between 1 cm below the hymen and TVL minus 2 is considered stage 3. And further descent beyond TVL minus 2 is considered stage 4. Now let's move to the anterior compartment. The first 3 cm on the anterior vaginal wall is assessed by point A anterior, which is normally present 3 cm before the hymen, I mean minus 3. But it could be minus 2, minus 1, 0, plus 1, plus 2, or even plus 3. The remaining part on the anterior vaginal wall is assessed by point B anterior, which is normally present 3 cm before the hymen, I mean minus 3. But it could descend to any area in stage 1, stage 2, stage 3, or even stage 4. Moving to the posterior compartment assessment, it is assessed in the same way as the anterior compartment. I mean, the first 3 cm are assessed by point A posterior, while the remaining part on the posterior vaginal wall is assessed by point B posterior. Now let's assess the stage of prolapse in our case scenario. We know that total vaginal length is 10 cm and the cervix prolapsed to 6 cm beyond the hymen. This means apical compartment prolapse is stage 3. In the anterior compartment, A anterior is plus 3 and the B anterior is plus 5. Here you can see A anterior and B anterior. This means the anterior compartment is also prolapsed to stage 3. Similarly, the posterior compartment prolapse so that A posterior is +3 and B posterior is +5, and this means the posterior compartment prolapse is stage 3. Regarding the shape of the perineum, we measure the genital hiatus, which extends between the urethral orifice and the posterior hymenal margin, and it measures 4 cm in our case scenario. The perineal body extends from the posterior hymenal margin till the anal orifice, and in this clinical scenario it measures 2 cm.